All right, let's talk about something that affects millions of people but is, often discussed in whispers, if at all. We're talking about hemorrhoids. It's an incredibly common condition, but it's also one of the most misunderstood. So let's just dive right in and clear up the biggest misconception from the get-go.
So, let me ask you this. What if I told you that the things we call hemorrhoids are actually a normal, functional part of every single person's body? Seriously, getting this one point is the key to demystifying this entire condition.
So, where does all this confusion come from? Well, it really just boils down to the difference between a normal body part and an actual medical condition.
You see, what every single one of us has is hemorrhoidal tissue. The best way to think about it is as these soft, protective cushions made up of blood vessels and muscle. Their whole job is to swell up with blood to protect the anal canal and then shrink right back down. They're a totally crucial and totally normal part of our anatomy.
So here is the absolute key takeaway. The word hemorrhoids should really only be used when that normal tissue starts causing problems. When it gets inflamed, swollen, and starts giving you symptoms. It's not about having the tissue. It's about when that tissue turns into a condition.
Okay, so if this tissue is perfectly normal, how does it go from being helpful to being, well, a real pain? To understand that, we need to take a quick look at the underlying anatomy where things can go wrong.
It all comes down to two different networks of veins. You've got an internal network located higher up and an external one that's lower down, right under the skin. And the dividing line between them is this little anatomical landmark called the pectinate line. And its location is everything because it determines what type of hemorrhage you might get and the symptoms you're going to feel. And here's a cool little detail to help you picture this. These cushions of tissue aren't just placed randomly. They usually form in three main clusters at what doctors describe as the 3, 7, and 11 o'clock positions. So yeah, there's actually a surprising amount of structure to it. This split between the two networks of veins leads us directly to the two main types of hemorrhoids, internal and external. They come from different places, and because of that, they behave in completely different ways. This chart really lays out the differences perfectly. Okay, so internal hemorrhoids are above that pectinate line, where there are very few pain-sensing nerves. That's a big deal. It's why their main symptom is often painless bleeding. They're caused by the swelling of that network of arteries and veins. But external hemorrhoids, they're below the line, covered by skin that is full of nerves. And that's why they're painful, especially when they're caused by an acute thrombosis, which is really just a blood clot that pops up and creates sudden painful swelling. Okay, so we've covered the what and the where. But what about the why? Why does this normal tissue become a problem in the first place? What's triggering all this inflammation and swelling? Well, it almost always boils down to one word: pressure. Anything that increases the pressure in that lower rectal area can cause these venous cushions to get swollen and stay that way. The biggest culprit, by far, is straining during a bowel movement, usually because of constipation. But other things like pregnancy, lifting heavy weights, and obesity all crank up that internal pressure, leading to the exact same result. Now, let's get to the good news, because there is good news. While this condition can be really uncomfortable, the approach to diagnosis and treatment is very logical, very structured. It's definitely not a one-size-fits-all kind of thing. And this right here is the guiding philosophy of treatment. The focus is completely on the patient's symptoms, not just on what a doctor happens to see. Basically, if it doesn't bother you, the approach is generally not to treat it. It's all about improving your quality of life. For internal hemorrhoids, treatment follows this really clear clinical grading system. It's all based on how much they prolapse, which is just a word for how far they slip down or bulge out. So grade 1 hemorrhoids don't prolapse at all, they just might bleed. Grade 2 pop out, but they go back in on their own. By the time you get to grade 4, they're permanently prolapsed. This system gives doctors a really precise roadmap for what to do next. And here is that roadmap. You can see how the treatment just escalates right along with the grade. For grade 1, it's all about conservative lifestyle stuff, more fiber, more water. Simple. For grades 2 and 3, you're often looking at non-surgical procedures that can be done right in a doctor's office. It's really only for the most severe grade 4 cases that surgery becomes the main option. So what about those painful external ones? Well, since they're often caused by a sudden clot, if they're really causing problems, the treatment is much more direct. It usually involves a simple surgical procedure to remove the clot and give you some pretty immediate